Hello, my name is Kenzie Ryder, and I am going to be discussing the against side of PECS. When I first signed up for this debate, I chose to be pro-PECS. I was a little disappointed to find out that I would have to side with the con side of this debate. I thought that I was so pro-PECS that this would be extremely difficult for me, but with the help of some different sources as well as some information from a mother of a child who has used this approach, I was actually able to find quite a few downfalls to this approach. PECS stands for Picture Exchange Communication System. PECS is an augmentative alternative communication system designed to teach children with limited communication skills to initiate communication within a social context. It can be intended to 1. Increase requesting of items. 2. Increase social interactions. 3. Practice social skills such as eye contact. 4. Practice attending skills such as paying attention to who has the desired item. And 5. Help others understand what is being requested due to poor pronunciation of words. A few downfalls to PECS include 1. Difficulty interpreting generic symbols. Some children may have problems understanding what the different pictures mean. Generic symbols may closely resemble many different things, though you can try to find pictures that you think most closely resemble what they would want to say. The child may see things differently. This is something that may be trial and error to find what pictures work best for the child. 2. Communication is limited to the pictures available. The child can only communicate using the pictures available. This really limits them because they can only say so much. There are so many different words and so many things to say, and you can definitely not have every word choice available for the child. I spoke with a mother of a child that has used PECS with her son. She was not a very big fan of this therapy technique because it really limited him. This downfall is something that she really stressed to me. No child should have to be limited on what they say and how they express themselves. It could make anyone become upset or frustrated if they couldn't say what they wanted to say, not just an individual with autism. 3. Adult must plan ahead for pictures needed. This needs to be put together by the adult, so the adult needs to plan ahead for the pictures. This can be very time-consuming, and the adults may find it difficult. As well as all of the planning, pictures may easily be lost. It is important to keep track of all parts of this system in order for it to be beneficial for the child. If different pictures are lost, the child will not be able to communicate efficiently. 4. PECS must be used in all settings to have the most benefit. In order for PECS to be beneficial for the child, it needs to be used in every setting. If you are only using it at school, or only in therapy, or only at home, it will not be as useful for the child because they will struggle to communicate when it is not in use. In fact, they may not be able to communicate at all without it. You would need to carry your PECS system everywhere you go, and this is not always convenient. When looking into therapy types, we need to keep in mind that oftentimes only the pros are talked about or shown. To any therapy type, there are always downfalls, and we should always look into those. Another important thing to remember is that all children with autism spectrum disorder are different, hence why they have changed this from autism to autism spectrum, because it can be such a wide range of characteristics. You should always look into different therapy techniques to find one that best suits a specific child. Just because a certain therapy worked well for one ASD child does not mean that it will work well for the next. Thank you.